My name is Catherine Rodella. I'm the program manager for the Master of Healthcare Innovation. So I manage the administrative side of the program, which involves a lot of student affairs and student support. I'm generally the point of contact for applicants and also for current students. So I'll be leading most of the presentation. A little bit later, we'll also hear from Adam Zolklover, who leads our instructional and course delivery team, and he'll give you a little walkthrough of what one of the online courses looks like. I'm going to do a general overview that includes the structure of the degree. We'll talk about the curriculum a bit, tuition, and there's also an on-campus component to the degree, excuse me. So I'll explain how that works. Like I said, Adam will talk a bit about what learning online is like, and we'll show you what the online classes look like. We're very lucky to be joined by a couple of our current students who will be able to give some of their experience about the program. I'll explain how the admissions process works, and then at the end we'll have that dedicated Q&A session, both with the staff and with the current students who are on the call. And again, if you have any questions throughout the presentation, feel free to just type them in that chat box. You don't have to wait till the end if you have any burning questions. First, a bit of an overview about the program and what the mission and goals of it are. Like I said, the Master of Healthcare Innovation is an online degree program from the University of Pennsylvania. It's housed in the Perelman School of Medicine, and more specifically in the Department of Medical Ethics and Health Policy. So the degree is conferred by the Perelman School of Medicine at the University of Pennsylvania. The program's overall mission is to address the rapidly changing healthcare landscape by advancing innovation among healthcare professionals. And the way it does that is through online learning. It's a fairly new program. It's just started its second year this fall. It's the first fully online degree program at the University of Pennsylvania. And what's important to note is that this program was designed from conception as an online program. So the courses are created brand new, designed to fit an online curriculum and an online platform. So these are not former in-person courses that were sort of just shoehorned into some online lectures. It's designed for mid-career healthcare professionals, so people who are currently working in healthcare, people who can apply practical tools and skills in their current and future workplaces. So rather than a research degree, it's really meant to be a pragmatic degree. The ultimate goal is to help you improve healthcare delivery, whether you're a clinician or non-clinician, whatever sector of healthcare you might be working in. And because it's designed to be online, it's really optimized for flexibility for full-time working professionals. The degree meets this goal of helping you improve healthcare delivery through a few specific ways. The first, one of the most important ways, is by building a network of healthcare professionals. It's a cohort program, so you stick with your cohort throughout the program, and there's a lot of opportunity for collaboration and networking with those students as you go. The courses are designed to help you develop systemic solutions to problems in healthcare delivery, so that could be at all different levels of the healthcare system. And finally, you'll be able to apply concepts in practice-based innovation labs, and we'll talk a little bit more about how those work specifically later. The degree does have four main areas of focus that the classes focus on. Those are health policy, behavioral economics, operations management, and innovation methodologies. And these are all taught by senior level expert faculty. We have a very multidisciplinary faculty membership. They come from the School of Medicine, from the Wharton School of Business, Penn Law, and the Penn Medicine Center for Healthcare Innovation. Our students are all mid-career healthcare professionals. They're all working full-time, so we're very used to working with people who have all sorts of crazy schedules and all sorts of competing responsibilities while they're working towards the degree. They have an average of 14 years of experience working professionally in healthcare, but there is a wide range there. We have students who have been working for 4 years, students have been working for 30 or more years. They come from all over the United States, and this year we we got our first international student from Tokyo, Japan, which is very exciting for us. And they come from a wide variety of different healthcare sectors. So the program is not designed to be just for clinicians or just for administrators or any one particular group. It's really meant to bring together a wide variety of perspectives and experiences to help you put your role in the healthcare system into context. So some examples of the types of backgrounds our students have, they come from hospitals and health systems, academic medical centers. We have Tori, who's on the call today, works at a nudge unit, people from researchers from pharma companies, insurance. And this is not an exhaustive list of the types of backgrounds students might come from. Off the top of my head, a few examples that we haven't seen yet among our student body, but who could be a good fit, are people from medical device companies, government agencies, even dental medicine. And students decide to do this program for a number of reasons. Our students tend to fit three main buckets. The first group wants to improve the way they do work and the way they deliver care in their current role. Some students have recently or are taking on a new role, so they want to learn skills and fill knowledge gaps to make sure they can succeed in this new role. And finally, a lot of them will aspire to a more leadership position in the future and hope that this degree can help them get there. This slide is a nice bird's eye view of the curriculum. It lays out the schedule for the 2018 to 2019, or sorry, the 2018 to 2020 cohort that just started this fall. So you can see it's a 20-month program. Students always matriculate in fall, and then they would typically graduate in spring of their second year. You can see this key in the bottom left-hand corner shows you what type of classes there are. The two green ones are not classes. That's the Healthcare Innovation Seminar is the on-campus session that we do. So that's the first thing that happens each academic year. Everybody comes onto campus and meets together in person for 4.5 days in Philadelphia before they go off and do their online work. And I'll explain how the on-campus session works in more detail a little bit later. There are core courses in blue. Those courses provide the foundational concepts of the degree, so those main areas that I mentioned before, health policy, healthcare operations, behavioral economics, and innovation methodologies. They're typically 6 weeks long each, and they're taken one at a time. And each of those 6-week-long courses is equivalent to a typical semester-long course. So they are a bit intensive, they're fast-paced, they're condensed down into those 6 weeks. But you are only taking one at a time, so you really can focus on just that topic while you're in that course. The electives are the pinkish-looking courses there. Electives change a bit year to year depending on students' interests, but they are a way to sort of cater your curriculum to your interests more specifically. You'll have several electives to choose from there. And then finally, there are lab courses highlighted in yellow. Those courses are associated with a core course, and they're where you will really get to apply and get some hands-on practice with these innovation concepts. I want to explain a bit more about the lab courses since they are a little bit different. It's not what you might imagine as your traditional lab course.
Catherine, I don't want to interrupt you, but we do have a question. Can you please provide some examples of electives?
Yep. We're actually going to do that after the labs, but I can do that now. So electives are two smaller paired complementary topics. So they are 6-week courses, just like the core courses, but you would have 3 weeks in one topic and 3 weeks in another topic that are paired together. Like I said, they might change year to year, but here are the examples of electives that are being offered this year. They cover health disparities, so that health disparities and global population health course is a very public health and policy focused course. Driving value in the system and health insurance and benefit design. Then there is a health law and ethics class. And finally, connected health, which focuses a lot on the effect of technology on the healthcare business and disruptive technologies and healthcare leadership. And finally, there's an alternative option, which is a intensive mediation workshop that's taught on campus for 4 days. The students would choose 2 of these elective pairs, which might change year to year depending on student interests. So these online lab courses are a bit different than the sort of traditional lab courses that you might imagine from an undergrad degree. They are still a way in which you're going to apply concepts from the courses and practice the lecture-based concepts that you learn. And there are 4 of them. They're affiliated with core courses. So you can see applying behavioral economics would be affiliated, for example, with the behavioral economics core course. And throughout these 4 lab courses, the common thread is that you will, at the end of the program, have an actual proposal for an innovation pitch and project in hand that you'll then be ready to implement once you graduate. The first 2 lab courses focus more on helping you learn how to develop your idea and get it out into the world. And then the last 2 lab courses are where you draw from your work experience to develop an actual project idea and prepare to implement it. Tuition is usually one of the top questions everybody has. Tuition is billed on a course unit basis. That's the credit unit that Penn uses for its courses. One course unit is roughly equivalent to a traditional semester-long course, which usually would be a 3 or 4 credit hour course at another university. For this academic year, tuition and fees for one course unit is $5,655, and students will take 11 course units throughout the degree. So all told, the projected total cost based on rates right now is in the ballpark of $63,000. Rates might be subject to some small changes. And right now there are no scholarships or fellowships available directly from the program. Some students will get funding from their employers, some students are self-funded, and some choose to pursue federal loans. So if you are thinking about going the loan route, just be aware that you need to have at least 2 course units in a semester to be eligible for that semester. And you are, depending on how you choose your electives, you are able to create a curriculum in which you would have at least 2 credit units for every semester and be covered for all of those semesters.
Somebody asks, if you're a faculty member here at Penn, is tuition covered?
Tuition isn't covered 100%, but you can use employee tuition benefits to cover a portion of the cost. It depends a lot on your individual employment status and other classes you might be taking. So if you want to get into more details, email me and I'll be happy to talk you through it a little bit more. Part of what's included in the tuition is the on-campus seminar. Every student will attend that twice total throughout the degree. So it's always in August at the beginning of each academic year. The next one is scheduled for August 17 through 21st. And it's held right here in Philadelphia on Penn's campus. It's a very intensive, very fun, very educational week. It's jam-packed with a lot of activities. First and foremost, activities that are meant to help you connect with your fellow students, connect with the faculty, and start to build those relationships that you'll carry out through the degree. The types of activities we do include some interactive workshops. For example, we've done ones on public presentations and on negotiation. There are expert presentations and panels and orientation sessions for new students to teach them how the classes work and how to navigate all the technology. The program provides lodging for students. It covers the cost of activities and covers the cost of your meals throughout the week, and students are just responsible for their travel to and from Philadelphia. So a bit about the course experience. This is the part that most of our students are more, it's unfamiliar territory before they come in. A lot of students have either never taken an online course before, or maybe they've just done things like a webinar for work and not an academic course online. So you should expect to spend about 10 to 12 hours per week working on these courses. Courses are split into course content is split into 3 main categories. The first is content and media. Courses will always have brief, engaging videos that are either lecture presentations or interviews with experts. There are readings to provide context for the videos. And then there's the interaction piece, which is very important. Every week there will be discussion threads to respond to, and you'll have weekly interaction with faculty, and those include live video synchronous sessions that are scheduled ahead of time. So those keep you engaged and connected with each other and help you ask questions directly of the faculty member. And finally, assessments to reinforce key concepts and to evaluate how you're doing. Those might be in the form of quizzes. There are assignments and final projects where you get practical tools and practice the concepts. And there's support from course assistants, like teaching assistants and our course coordinator. So there are deadlines, there are grades, but the courses are designed to be flexible. They're designed for full-time working professionals to be able to take them and fit them into their work schedules. Content and media are available on demand within the course run dates, so courses have set start and end dates in which you can access the content. There are deadlines to help you stay on track, but we're very used to helping students work around their schedules, so if you have any concerns about deadlines, you can always talk to us. And then typically you have 1 week off between courses to be able to pause and catch up on things outside of class that you need to catch up on. With that, I'm going to turn it over to Adam for a couple of minutes. Adam leads our instructional and course delivery team, and he's going to show you a course on Canvas, which is the platform on which our courses are run.
Hi, everybody. My name is Adam. I'm going to take over the screen share for just a second here. I just wanted to take you through a couple of features of our course, and so as an example, what I'm using is the latest version of the American Healthcare System, which is the first course in our series. It's taught by Professor Emanuel, who is also instrumental in creating a lot of the shape of the curriculum. So as you can see, this is the front page of the course. We have a nice course title. We have information about the instructor. In a real version of the course, you would have email access to the instructor as well as to the TAs for the course. It has a course overview and a course structure. There's no reason for you to read this right now, and we can provide some screenshots if it would help you. The main thing that I wanted to show you is coming down to key topics and dates. There is a clear list of all of the things that you'll need to do over the 6 weeks of each course, or in the case of electives, the 3 weeks of each elective. And then I wanted to take you down to the bottom of the front page, which has a big red Start Here button. So I'm going to click on the Start Here button right now, and you'll see I'm not actually going to click on it. I'm just going to take you over to modules. But when you click on the Start Here button, this is what comes up. And what comes up is a structure of the entire course. The course begins with a module that orients you toward how to take the course, so you get a lot of support in that respect. And then each weekly module includes, as Catherine said, content that you can watch, content that you can read, opportunities to collaborate, and that includes a synchronous session for most courses, so you're able to talk directly to the faculty. That includes discussion forums, and that includes a weekly quiz where you can also test your knowledge. There's two other parts of the course that I wanted to show you, and then I wanted to address a couple of the questions. One is, what does a lecture page look like? So courses are largely made up of lectures, and this is one that I think is really useful. I'm not going to play the video for you because it doesn't come through well on BlueJeans, but what you can see is that every lecture page has a title. It has an embedded video that you can watch. It looks just like YouTube. And then it has support links where you can get help with anything that is a problem or that you need further clarification on. And that includes help with the learning management system, but that also includes help with anything else that you need in these courses. There's ways to contact our course coordinator and the TAs from these pages. The last thing that I want to show you is a discussion forum. I'm not going to take you through the student responses to it, but I am going to show you just an example of what a discussion is. Every week, students get a prompt, and the prompt relates back to the work that they've been doing, so that would be the lectures and the readings, and you're asked to make one substantive post and then reply to two other posts. There is a rhythm to all of these classes. Work is usually due on Sundays and on Tuesdays, unless there's some special reason not to. So you're able to start to predict your schedule after a while in these courses. Somebody had asked about grading scale, and I wanted to briefly go back to that. Courses are graded on an A through F scale. They are not curved. Our philosophy here is that if you're doing well in a course and if you're learning the material, we want to reflect that you're doing well. This isn't a competition. The philosophy here is that a rising tide lifts all boats. So with that, I'm going to turn it back over to Catherine.
Thanks, Adam. I'm going to take a second now to stop and go back to a few questions that had come in the meantime. Somebody asked, does the course for 2019 start in August, and if not, when can I start? Yes, so each year the on-campus session is in late August, and then the online coursework starts in early September. So students are always starting with the fall semester every year. And then somebody else asked, in terms of eligibility, is the program open for applicants who do not work in the health industry or doesn't have their undergraduate in health education? The program is designed for people who are currently working in a healthcare industry and who have enough experience working in healthcare to really be able to draw on those experiences for their assignments and to be able to apply the tools in their workplace. Someone else had asked if a specific course would transfer into the elective component. If you could email me that question, and I'll get that request reviewed for you. I wanted to share some tips and strategies for learning online. It is a very different way of learning, but an effective way of learning. But it can come with its own skill set that's required to really be successful at learning online. So it's good to have some of these things in mind before you even get into the program and start taking online classes. The first is you always want to make sure you understand expectations before you begin. So when you get into the course, read through the syllabus, take a look through all of the deadlines and all of the assignments so you know what to expect and what's coming up. And that also helps you schedule it around your work schedule. You know when really busy weeks will be. Take notes as you watch lecture videos and read materials just the same way as you would in a normal course. It really helps you remember concepts. And make sure to take frequent breaks. Learning online requires a lot of time management on your own. There's nobody telling you to come to a classroom at a certain time every week. So make sure you pace yourself. Give yourself a chance to really absorb the material. Keep in contact with the teaching assistants if you're feeling behind. Communication is really important, especially since you won't be physically here. You need to make the effort to reach out and stay engaged with the course team and with your students and with the instructors. It really adds to your learning experience. Participate in the discussion forums. Like I said, make sure you are taking the initiative to stay engaged. And be mindful of time management. Again, you should expect to be spending around 10 to 12 hours per week on these courses. And even though you'll be learning online and you might be physically by yourself off in your office or in your home when you're taking the course, there's always a lot of support available to you. We'll do a technology orientation at the on-campus session so that you'll know how to log in, how to access all the course material. There's a community site that you can always access for your reference. It has tips and tutorials about how to navigate the courses. You can get coursework help from the TAs and the course coordinator, administrative support from myself and our other administrative staff. And we have our own in-house technical support so that if you're really stuck, we can help you out.
Hi, Catherine. I think that we have some more questions. I don't know if you want to do that now or if you want to do that after Gary and Tori talk.
Sure. Let's go to those questions for a minute before we have Gary and Tori share some of their experiences. One person asked, is 2 years enough experience if you have an undergraduate degree in public health? We typically ask for at least 3 years of professional experience in healthcare, but if you feel you have other relevant experience that might make up for that, that is something that you can talk about in your personal statement. If you have a justification and a case that you can make to the admissions committee that you have enough experience to be able to draw on for the courses, you may be able to still try that. Another person asked, where have recent graduates placed in the industry and have most continued in the same role? So our very first class is going to be graduating this spring. So we actually don't have any graduates yet, but I can tell you a bit about the experience of our current students. We do have a couple who have gotten new roles as a result of the degree while they're still in the program. One of those is a physician. She's a family physician who took on a role as the director of inclusion and equity for her practice group. Another person is a nurse who's in the program who's taken on a newly created role of a bundled care navigator for patients at her hospital. And it remains to be seen what the rest of our graduates will do. Finally, I'll answer one more question before we have Gary and Tori come on. Is there a limit Is there a limit on the number of students you accept? There is no specific number limit, but the plan is to keep the cohorts relatively small so that they are high touch and highly interactive.
Before Gary and Tori talk, I wanted to answer one question that I think I had missed in my section, if that's okay. Somebody had asked, are there finals? And the answer is that no, there are not finals, but there are final projects for many classes, and there are labs, which in many cases are like finals in the sense that they ask you to synthesize information that you've learned from the class and apply it to, in a lot of cases, your own professional context.
Great, thanks. All right, Gary and Tori, this is your time to shine. I have a few questions for you so that you can share a bit of your experience in the program with these prospective students. First of all, thank you so much for taking the time to do this today. Can you start off just by briefly introducing yourself and explaining why you decided to pursue the Master of Healthcare Innovation? Gary, do you want to start?
Sure. My name is Gary Bubley. I'm an emergency physician at Brown in Providence, Rhode Island. I'm on the upper end of the spectrum of practice experience. It sounds like, from the cohort. I've been sort of in practice for 28 years when I enrolled in this program. And I've been active in our emergency department group administration for pretty much the last sort of 2/3 of my career, and was looking for something to help understand how to sort of further navigate new payment models and really understand the ACA better. And I looked at different programs, including several MBA programs, MHA programs, and found this program and thought this really was more uniquely suited to what I was looking for. And I just think the caliber of the faculty was really outstanding compared to many of the other programs I looked at. And not to there's an excellent program here at Brown that's like an executive master's in healthcare leadership, but I actually thought that the caliber of the faculty at this program at UPenn, that they were all really rock stars and really more kind of aligned with what I was trying to get out of the program. So it was kind of an easy choice when I looked through the kind of curriculum and sort of, again, the CVs of the faculty, that it was kind of an easy choice to sort of select this program. And I just want to say, by the way, that, the faculty are, super accessible. I can honestly say I spent, more time with the faculty in that first on-campus block than I did in 4 years of undergraduate college. So anyway, on that note, I'll hand it over to Tori.
Hi, everyone. Thanks for having me. My name is Tori Harrington. I am a research coordinator here at the University of Pennsylvania. I work specifically in the Penn Medicine Nudge Unit, which lives within the Center for Healthcare Innovation. And I've been in research for about 4 years, maybe 5. And I first found this program through, just like Gary said, a lot of looking into MPH programs or MBA and kind of seeing what was out there. But this one really grabbed my attention for a lot of reasons. The topic, obviously, healthcare, also the online don't have, like, trying to find time to go to classes isn't really possible. And I loved the small cohort idea. My biggest worry with online was not being able to connect with classmates or feeling kind of disconnected from the process. And I think the small cohorts really helped, and the in-person meetings to really connect and honestly feel very connected to everyone and communicate regularly. And also, like, the timeline for this program was great in terms of it being 20 months as opposed to some other ones I looked at, which would end up taking probably 3 or 4 years to complete.
Hey, thanks, Tori. I'm going to stick with you for the next question. Uh, so all of our students are working full time. They're all super busy. Can you talk a little bit about how you've found time, carved out time for this program amidst all your other work and home responsibilities?
Yeah, so I'm a single mom. I have a 4-year-old daughter, and I work full time as everyone else in the program does. So balancing is very important. Um, and I think you said it best when you're talking about time management, which I'm going to be honest, was never a skill of mine. I'm the person who always went to the time management workshops. But this has been really great in terms of getting the schedule ahead of time and knowing when the due dates are and what's coming up to kind of plan my carving out time for that. I've also learned to take advantage of my commute. I take the train in every day to the city. So I'm able to listen to the classes on my commute and kind of take advantage of that time that was only wasted. Um, and I think the support from the staff has been really, and the teachers and the TA, everyone's working full time as well. And they're very understanding of, you know, someone's sick and I can't get it in, or clarifying information. So I think that that has really helped in terms of balancing.
Great, thank you. This next question is for both of you. So, Gary, why don't we pop back to you for a second? And can you talk a bit about how the program has impacted your work so far?
Yeah, I'm kind of lucky. I get to do a lot of different things in my, role as vice chair, and I sort of do a lot of the negotiating with the payers directly for our group, which is, a pretty large group in Rhode Island. And I've gotten to use many of the principles we've learned, sort of about just sort of the way insurance benefits are designed and what sort of goes behind some of the rationale in behavioral health economics. I oversee clinical operations for our EDs. We see about 279,000 visits annually, and so I just like totally ate up the healthcare operations course that we had from Professor Turwish, and really got to use implement these principles that we were learning directly into my job, in terms of leading operations. I can kind of go on and on. I mean, some of the stuff was sort of negotiation skills. I've been active. Rhode Island's a pretty small state, so many of us are active in terms of healthcare policy as well. And so I've, had been involved with that previously, but this helped give me a better understanding too of, again, how to be just more effective in implementing policy. I can honestly say I've sort of, used something from every single one of our courses, so far in terms of my, sort of daily work.
Great, thanks.
Right.
And Tori, so I know you've only had really one semester so far, but have you seen that the program start to impact your work in any ways yet?
Yeah, actually, surprisingly, yeah, so I started in August, so it has just finished our first term and starting the second. But it really has enriched my work experience. I do work in clinical research, but my undergrad was in sociology. So I feel like I kind of lacked some of that clinical health system understanding. And I've obviously picked up a lot from working, but uh, learning about insurance and how things work in this health system and kind of have this much clearer picture of its complexities and understanding how it works. And that kind of brings a new lens for me to the research in terms of developing new ideas or how to go about things, and also gives me a clearer picture of the overall goals that we're working on.
All right, last question is for Gary. You are, it's hard to believe, but almost done with the program. You'll be graduating this spring. So over the past year and a half or so, have you built a network? Can you talk a bit about the cohort experience?
Yeah, it's really been a lot of fun. I mean, I think the networking part of the experience has been tremendous. I think, I was really impressed when we came together on campus and got to really be fully immersed with everybody and, got to know everyone and felt, so like sort of I left with, 17 new friends kind of on that after that first week. And our group's been pretty tight, pretty cohesive. We kind of communicate almost daily, sometimes many times a day, via sort of WhatsApp, with a chat group as well as, sort of on the discussion boards. So, there's a lot of very sort of supportive help between the sort of students in the group. And, it was really a lot of fun sort of becoming a student again with everybody on campus. So, pretty entertaining. And, I've gotten together with some of the students. I ran into one of my classmates here, in Providence, just happened to be at the same restaurant in town. She was kind of traveling, doing some consulting work. That was a lot of fun getting together there. Like I went out to our national ACEP conference out in San Diego in October and made a point of getting together with, one of my classmates, Ray, who's, become a great friend. So he and his wife and my wife and I got together, had a wonderful time while we were out in California. So it's been sort of a lot of fun kind of bonding with the people in the group.
Great, thanks. Thanks both of you so much. We really appreciate it. Gary and Tori will both stick around for Q&A at the end. So if you have any questions for current students, you can ask then. All right, I will share my screen again and put the presentation back up. So if after everything that you've heard, you decide that this program sounds pretty great, you want to apply, the first deadline is February 15th. You can apply by going online. The website is improvinghealthcare.net, and you'll see a link to an online application on the admissions page. So with the online application, you'll be asked to fill out the form and also upload a personal statement, 1 or 2 pages talking about your reasons for pursuing the program and how it fits into your career trajectory. We'll ask for a current CV or resume and 2 letters of recommendation. And just so you're aware, in the online form, once you put in your recommender's contact information and hit save, they will automatically get an email from the system asking them to upload a letter to the online application. So you might want to give them a heads up ahead of time to be on the lookout for that email from the application system. We also require official transcripts from your previous colleges and universities. Those are not uploaded to the online application. They're sent directly from the institution to us, and the contact information for that is on the admissions page. Like I mentioned, the next deadline is February 15th, and then the final deadline is May 1st. You can apply towards either of those deadlines to be able to start this August. The difference is that if you apply to the earlier deadline, you'll get your decision earlier. In both cases, you should expect a decision within roughly 4 weeks after the deadline. That pretty much concludes our presentation. Before we start the Q&A, I did want to mention that there is a certificate option if you decide that pursuing a full master's degree maybe isn't the right choice for you. There are 2 different tracks that we offer for the certificate. One of them is a professional development track. This track is non-credit courses. So same course topics, but they're not for academic course credit. And what that means is that they're a bit less rigorous, less time intensive, less faculty interaction. And so they also are cheaper. They're $15.49 per course. And then there's an academic credit track. The credit track is graduate level credit bearing courses drawn from the master's curriculum. Those courses can be transferred into the master's program as opposed to the professional development courses. Right now, the credit track is only open to people at Penn, but we're planning to open it to people outside of Penn starting this fall. So if you think the certificate might be more of what you're looking for, you can be on the lookout for that application opening up a little bit before this fall. And that's all we have to present to you. So if you have any other questions, this is your time that you can ask them. You can ask questions for me or Adam, or for Tori and Gary. You can feel free to type them in the chat box on the right side, or if you have a microphone and want to share, you're welcome to do that too.
While people are thinking about their questions, I wanted to go back and answer a couple that we've gotten in the meantime, if that's okay.
Sure.
One is somebody asks if Roy Rosen is involved in this program, and he is. He's one of the teachers for translating ideas into outcomes, which is our core course on innovation methodology. And another person asks about the reading list for Dr. Emanuel's class, and the two core books for that are Prescription for the Future and Reinventing American Healthcare. Both of them are widely available, and I'm sure that he would appreciate it if you were going to go and buy his books. But the thing that you should know is that new entrants into the program get those books as part of the on-campus seminar.
One question that we get asked a lot while you're thinking of your questions is, what's the difference between this degree and, say, an MBA or a Master of Healthcare Administration or a Master of Public Health? This is a fairly unique niche degree. The Master of Healthcare Innovation, is really about contextualizing your role in the larger healthcare system. It asks the questions, how do we improve the healthcare delivery process, not only for patients, but also for providers and payers and for everybody who's involved in the healthcare system. An MBA is going to be a little bit more broad and not as healthcare focused. It'll be more management focused and not so much about improving the way healthcare is delivered. Master of Healthcare Administration is definitely more focused for people who are expecting to go into administration or people who are already in administration, whereas the Master of Healthcare Innovation will be a more mixed variety of backgrounds and industries. And an MHA would also include more finance and management related courses. Finally, a Master of Public Health will probably have more epidemiology focus, environmental and occupational health, which aren't really foci of this program. There might be some overlap, though. And MPH degrees might be a little bit more research focused, whereas this is a more pragmatic degree. It's meant to give you things that you're going to apply right away.
Several people have asked how large the cohort is. Do you want to address that one?
Yeah, the cohort that just started this fall, I believe, is 18 students. So we try to keep it pretty tight-knit, so it's very high interaction and high touch.
Somebody asks when the program started.
Yeah, our first class started in fall of 2017. So this year kicks off our second year of the program. And the first graduating class will graduate this spring.
Is there only one cohort? Somebody asks.
There are always two cohorts going at the same time. You'll be taking your classes only with the cohort that started at the same time as you. So there's always a cohort of first-year students and a cohort of second-year students going through the program at the same time, and they'll be able to interact a bit at the on-campus session.
Can you please show the slide that shows the other course tracks, the professional development track, etc.?
Up here are the two certificate tracks. So right now, the professional development track, that one on the left, is open to everyone. That's a non-credit track. It's supposed to be for people who maybe don't want to do a full master's degree, but they want the skills to be able to apply right away in their workplace. It's definitely less academically rigorous, less time intensive, and it's less expensive since there are no academic course credits involved. For that one, you can take courses individually, or if you want to earn the certificate, it's 4 courses within 1 year. And then for the academic credit track, Those are graduate level credit-bearing courses, so they can be transferred into the Master of Healthcare Innovation. Right now, that certificate track is only open to people who are already at Penn or already enrolled in Penn graduate programs, but we're planning to open that up to people outside of Penn starting this fall. So that application hopefully will be opening in a few months from now.
Rebecca asks, is this program too rigorous for those working full-time? Can you do it part-time or course by course?
So the program is rigorous, but it's designed for people who are working full-time. Everyone in the program is working full-time. We have people with all sorts of insane work schedules and family obligations, and it's really designed to be flexible. Another advantage of that small cohort size is that we can really work with students one-on-one to sort of work around any time or scheduling conflicts they might have as much as we can. And since it is designed to be taken as a cohort, there's not a part-time option. It's a set schedule that cohorts take together. So it's designed to be completed in 20 months.
The other thing that I would add to that is that courses are taken one at a time. They're 6-week courses and they don't overlap.
Yeah, and there's always at least 1 week off in between classes, so that gives you some time to sort of reset and catch up on things from outside of the classwork that you need to catch up on. Somebody
Rebecca,
asked, oh, sorry.
Sorry.
I can take this one. Will you take graduate transfer credits from another institution's MHA program? If you have taken relevant graduate courses from another program, they might be able to get transferred in. There is a review process. Our assistant faculty director would need to review the courses and make a decision on whether or not they can transfer in. So you can email me and I'll get the materials from you that we need about the course, and then we can start getting those reviewed. Somebody else asked, if I were to enroll in the academic credit track, can I take any course at any time during the calendar year? For the academic credit track, you can jump in and out and take the courses at any point. The schedule follows the master's curriculum schedule, so you can't take any course at any time of the year, but you can pick and choose which courses you want to take, and you don't have to start in any particular semester or take them in any particular sequence for the certificate track. And one thing I forgot to mention about the academic credit track is if you want to earn the full certificate, you need to take 4 courses within 2 years, as opposed to the professional development is 4 courses within 1 year.
Just to add on to that, courses usually run once or twice per academic year.
Great, thanks. All right, well, it looks like everybody has asked their questions for now. Again, feel free to contact me afterwards if you think of any more, and thanks so much for spending your afternoon with us. Have a good night, everyone.